Welcome to Health Affairs from A to Z. We want you to be a part of this show. So this is a call-in health-related program. So dial up if you have any questions for us today. Let me introduce myself. I'm Nancy Valentine. I'm a professor and an associate dean for practice, policy, and partnerships at the University of Illinois at Chicago College of Nursing. And today I want to introduce our guest, who is a school nurse. So we're going to be talking about school nursing, and we've got a school nurse expert. Let me introduce you to my fellow colleague, Kathy Youngkitis, soon to be Dr. Youngkitis. She's studying for her doctoral degree in nursing science. Kathy is a content expert in school nursing, and she's going to tell you, based on many years of experience, what a school nurse does, how you can be involved with a school nurse if you have a child, or if you are a grandparent, a friend, etc. And she's going to also be telling you, if you are an aspiring nurse or you are already a nurse, what options are available for you to perhaps consider becoming a school nurse. So she is a child health champion, that is for sure. Kathy is one of these very positive people that really has child welfare at her heart, and really that is what she is very dedicated to doing. She consults with the Illinois State Board of Education and the Illinois Department of Public Health on all matters related to school health. So she is seen as an expert throughout the state of Illinois. She has a bachelor's degree from the University of Connecticut, a master's in community health, and she is also a certified school nurse. And as I said, she's going for her doctoral degree at U.I.C. College of Nursing. She is on the executive board of the Illinois Association of School Nurses, and she is also involved with the National Association for School Nurses. So Kathy does get around. And so this area of school nursing also extends to children in schools that have special needs and are in special education programs. So let's start out by me asking you, Kathy.
Sure.
How, as a nurse, did you become involved in school nursing?
Well, I think my story is pretty typical. I was a nurse, had, like, as you said, got my master's degree, and then I had a few children. And so moved out here to the Midwest and wasn't really sure, exactly where nursing was going to take me, but I knew I was going to continue to be in school nursing, in nursing. And one day I was signing a child out of school, and there was a call for nurses to work in the school, and I never knew that it would become the focus of my career, and ended up coming to U.I.C. to the program that I now run, and became certified in school nursing and worked in a local school district for several years. And then about 8 years ago, I came to the position I'm in now, where I work to train and to educate nurses about the specialty of school nursing.
That's wonderful. So when you first became a school nurse, since you really didn't know that much about it, what were some of the things that you noticed right off the bat in terms of what made this so interesting to you?
Well, I think one of the things that's very interesting is that it's very autonomous. In other words, you're the only healthcare person in the school, and so the nurse is the person that the student depends on and the family depends on, and often the doctors or nurses that are out in the community depend on to make sure that while the child is in school, while the student is in school, that they're being supported in their healthcare needs.
Right. So I learned from another colleague that many schools do not have a school nurse. I mean, that's one of the things that most people don't even recognize, and one of the things that we want to bring to your attention as a consumer. Believe it or not, there's only one state in the entire United States that requires a school nurse in every school. Isn't that a novel idea? And that is the state of Delaware, obviously one of the smallest states. And often school nurses are not in every school, not because they're not needed, but because they are seen as a budget issue, and when there are school cuts, etc., often school nurses are eliminated. Tell us from your point of view what impact that has on children.
Well, I think it's huge. One of our mottos, if you will, or the reason that nurses are in schools is because we're there to help students be ready to learn. And I think we all know that when we're not feeling well, our attention, and various other things are just are at a lower level. And certainly when we're expecting a child to learn and they have a health concern that's not being addressed, it certainly is a problem. So for instance, about anywhere from 10 to 25% of our population, of our student population, has some sort of a chronic illness, whether it be asthma, whether it be diabetes, whether it be a seizure disorder, or just one of many other genetic disorders or those types of things that they're coming to school with every day, and they need proper care and proper maintenance for that. And clearly, a parent can't be leaving work and coming in to care for a child, so a school nurse can be available in a school to help provide the support and sometimes case management, like referral or consulting with other doctors or nurse practitioners about the care for the student in school, as well as with the teachers and the administrators to help them understand exactly what needs to happen so that this child can be accessing their education, as we call it, but so that they can learn. The other thing is nurses help to decrease the absenteeism. So sometimes a child will come to our office and we can figure out what's going on. Now, they don't feel well, they have a stomach ache. Is it something serious that's going on, or is it something serious that's going on in the classroom that they don't want to be there to talk about? And unfortunately, what happens if there's not a nurse there to help kind of decide what's going on and make the proper assessment about what care a student might need, what happens is oftentimes they go home and then they miss time in the classroom. And it's so important for our students to be in their seats and learning. And so we want them to be healthy while they're learning, but we also want them to be there to learn. So it's really important to have your school nurse there. In addition, if you have a student with a health concern, what happens is, what if they're not learning well? What if it's impacting their ability to learn, even though they're there every day and even though we're doing the best job to maintain their health? Right. And that's where special education comes in. And nurses need to be involved in the special education process. And you may have heard the term IEP, that individualized education programming that goes on for students who have special needs. Well, nurses need to be at the table to help the teachers and the administrators and the parents understand what that student might need in school because of their health concerns. And the final reason why it's so important to have a nurse in school is that I think consumers will heartily agree with, is the idea of life-threatening allergies that can come up. And so having a nurse there to be able to understand when a child might have some exposure to maybe, say, a nut allergy, and be able to give epinephrine or those life-saving procedures that are needed. And in addition to that, nurses are there to prevent those things from happening. So that's another big role that we have, is in prevention and in screening. So to help do things with families and with students and with teachers to provide the safest environment that we can.
Right. I think for parents as well as for teachers, a school nurse is one of the first lines of defense and really helps you as a parent to bridge the time that you're not observing your child with something that your child might need. So let's talk about these different roles, because many people will not think of the school nurse as necessarily a really dynamic, covers the waterfront, kind of role. They may just have sort of a stereotypical view that the school nurse is sitting in an office somewhere filling out paperwork, which they do have to do. They do a lot of documentation for state and for other medical dimensions that need to have the school nurse sign off on different things. So unfortunately, they do have a lot of paperwork. But in addition to that, they have other roles, and this is what we're going to be looking at now. And I'd like, Kathy, for you to sort of walk us through what these various roles entail.
Sure. So you're absolutely right, Nancy. There is always that component of paperwork, but I like to think of that as just being kind of the supporting documentation for what we're doing. For instance, looking at immunizations and those types of things. We need to record those things and make sure our kids have them.
Right.
So this picture that you're looking at here was produced by the National Association of School Nurses, and it was an attempt to try and help others understand what a school nurse's practice might look like. So of course we're guided by ethics and standards, just like any other profession. So that's what's circling here. You can see in the circle it says standards. But the most important thing about this picture is look what's right in the center, the student. And that's embraced by the family and the school community.
And I like what it says. It says students, healthy, safe, and most importantly, ready to learn.
And absolutely, that is exactly what the school nurse is there to do. So all the things that we do has the student at the center. So the first and probably the most obvious, one that I spoke about a little bit earlier, is care coordination. So that's any of those things that we talked about as far as supporting a student to be in school in terms of maybe some direct care or consultation with families and physicians and nurse practitioners. The second one is leadership. When we're talking about helping administrators and families and others understand the laws that guide what's going on in a school. So maybe we have, for instance, the new epinephrine law that allowed us to have epinephrine in the schools. Well,
tell people what that is. Not everybody knows what epinephrine is.
So epinephrine is that medication that we give people who are having an allergic reaction called anaphylaxis. There's a lot of big words involved, but it basically means if you're exposed to an allergen, something you're allergic to, and you have a reaction that's actually literally going to cause your throat to close and for you to stop breathing. So a medication that is known to fix that is epinephrine. And so we have a law here in Illinois that says that schools can have epinephrine available, sort of like an emergency device, an emergency device we have in schools, AED machines. So those external defibrillators that you see in airports and health clubs and everything else. Well, there's a law that supports that. There's a law that supports another life-saving mechanism called epinephrine. And so nurses are there to try and are helpful in schools and leading to help schools understand why and when they need to have things like epinephrine in their schools. So that's what they're part of their many leadership responsibilities, setting guidelines for the different things that go on in schools that are health related. The next one is quality improvement. And that means that we're going to look at, and nurses are responsible for looking at the research to show, what's the best way to care for students in schools. So many of you may be familiar that for many years, students were sent home if they had what is something no one wants to hear about, but lice. Lice is a nuisance. It's not a communicable disease, and it's not a reason why students need to be excluded from school and to miss school time. And so nurses looked at the research and found that there's no reason to have to exclude a child from school just because they have lice. And then again, this way the child is doing what they're supposed to be, being in the classroom and ready to learn.
But they can be treated for lice.
Absolutely.
So they're not walking around with lice forever.
No, absolutely not. And that's another role that we have, is to help families figure out how to get that treatment.
Right. That's back to the leadership, helping families.
Absolutely. But that's just one of the many examples of trying to incorporate things into schools where the research shows us what's the best way to help get kids healthy. And then finally, our community and public health role. So we do screenings. Nurses do vision and hearing screenings in schools. They make sure that immunizations are up to date, and various other public health initiatives to help keep kids healthy. There's a nurse that I know here in Chicago who applied for a grant to get a salad bar in their school to help advance their ability to have healthy foods and healthy things in their school. And it was a grant through one of the big salad dressing companies.
That's really
impressive. So nurses absolutely are involved in a number of different things, not only just putting a Band-Aid on when someone falls down on the playground outside.
Right. I think that's important to recognize that this is a very complex role, because a good school nurse has to have a lot of different skills. They need to know what to do in an emergency. They need to know what to do to really prevent illness in a more preventative way. They need to know how to interact with parents, with teachers, but most importantly, they need to have a good relationship with the children so that the children know that they have a place to go if they have a problem. And I really would like you to tell us more about some of the cases that you've dealt with. I mean, let's think about it this way. If you have a healthy child, and you're sending your child to school, you're not really thinking about a school nurse that much. But even healthy children, what kinds of things can come up for a healthy child?
Well, certainly I think one of the big things, and it might be a term that people are familiar with or maybe not, but is the concept of the 504. So the 504 is just a name for a document that we use in schools for basically what you might be considered healthy, sometimes for what we might be called healthy children. But it's a document that helps educators understand what the needs of a child might be in school. So here's an example where you asked me about a typically healthy child. One thing might be a child who is in sports and activities and receives a concussion.
Okay.
Okay? So that's a very hot topic.
It is.
These days is concussion. And but there's a lot of ramifications. There's a lot of problems that can come when a child receives a concussion for whatever reason. Oftentimes in schools and for children, it's because of a sports-related injury. But there's a lot of needs related to that. They're generally on a short term, but maybe a child needs to have attend school for a lesser time, or maybe they need more time to take an exam, or many different things. And the school nurse is there to help the family interpret the doctor's orders about what the student needs, and help the school understand what the student needs, and then to write this thing that I'm calling a 504 plan. And I'm using that term because you may have heard of it as a parent, or you need to be aware of it as a parent to know that if your child has a temporary health need, that there may be some documentation that will help support that your child gets that. In this day and age when we have so much testing that goes on with our kids, the 504 document can also determine when and how a student might need proper accommodation so that they can take that test. So that might be a common one. As far as healthy children, there's preventative activities that nurses get involved with. One of our students recently did a bike to school day, for instance. So
a bike to school?
Bike. Ride your bicycle to school day. Sorry, I probably speak too quickly. But so biking to school is a really fun thing to do, and she was trying to promote physical activity, and to think about the fact that maybe you don't need to take the bus to school every day if you're within biking or walking distance. We've had other nurses do other activities related to similar things in terms of a school-sponsored walkathon, those types of things. So there's plenty of things that are health prevention type things that nurses often can be involved in if there's enough nurse time available.
Right, and that really gets us to the point that politically speaking, there are just not enough school nurses out there. That doesn't mean there are not enough people who are willing to be school nurses, who would be available to be school nurses, or could be trained to be school nurses. It has to do with the budgets of the schools. So as listeners, you really should listen up, and when you have an opportunity to advocate for your child, asking the question about how much nurse time is at your school where your child is attending is a very relevant question. Let's go to another case example. As you know, many children that have a lot of health compromises are still mainstreamed into our schools, which is a very good thing, so that they can be with other children, and it really helps everybody's development and ability to cope with things that are very challenging. But that also requires school nursing interventions in a very hands-on kind of way. So Kathy, for those viewers who may not have really seen this kind of a case, give us the overview of a complex case of a child in a school and what the role of the nurse is.
So I think probably the most common, one of the more common ones might be the care of a student with diabetes.
Okay.
Believe it or not, we do provide, I'll come back to that, we do provide care for students with very complex healthcare needs. So for instance, a child on a ventilator, or a child, and a ventilator would be a breathing machine that the child needs to support their breathing. And there are children who are born with a number of health concerns where they need one-to-one nursing support. Certainly those situations exist, and those students generally have a nurse that's with them almost all the time. But when I think about the complex things that may not seem as obvious to the consumer, and maybe to administrators and to teachers, is the care and the support that a student with diabetes needs. And I say that because we have children as early as maybe 3 years old who are preschoolers who are being diagnosed with insulin-dependent diabetes. That means they need insulin every day, multiple times a day, to control their blood sugars and to keep them healthy. And so the nurse gets involved with all sorts of levels of things where it's not only just making sure that blood sugar is kept at the appropriate level and that and insulin is administered, but also to do things like to teach the child how to care for themselves. Because we don't want a child to progress all the way through school being dependent on the nurse to help take care of them. What we want is that they're going to learn how to take care of themselves, because one day they're going to graduate and they're going to need to be able to do that. And we begin that as early as we can. So a 5-year-old, a child in kindergarten, might just learn how to take all this stuff out of his bag. And a high schooler is going to maybe just pop into the nurse's office once a day to check in, but will take care of themselves completely. But in between there is where the school nurse needs to help the student do all sorts of things, like understand the proper diet, to understand what we call count carbs, which is a very typical thing for a diabetic student to learn how to do, but they have to be able to do that. And we have them available for at least 2 meals generally of the day, and maybe even a snack time as well. And so it's a perfect opportunity for us to bridge our expertise as nurses in diabetes and as well in teaching and in all those things put together, so that we can support that child and then communicate back and forth with the parents or caregivers about what's been going on in their day. So as the student goes home for either the evening or for the weekend, they know what's been going on with their diabetes.
Right. So what I hear Kathy describing to us is that the school is not only a laboratory for learning intellectual things or psychosocial elements, like how to get along in groups and how to play well in the sandbox, so to speak, but it's also an environment where a lot of health teaching can go on, but very much steered by the school nurse, who is the most expert person that could be doing this education. So whether it's around preventative interventions, or it's something like the diabetes management, which is really something where all those techniques are learned over many years. It's not just simply knowing how to shoot your insulin into your muscle. There's more to it than that. And I think it's also helping to get other children together who have the similar issues, and the school nurse sort of helping them to bond and support them as a group to really know how to care for one another, very, very adequately. So there's a lot of teaching that goes on. So it sounds like when you have a school nurse, you're really in good shape. But if there are so many schools that don't have school nurses, or the school nurses are so thinly dispersed among multiple schools, where all they can do is really be a resource, like by phone, or make rounds once a week or once every 2 weeks in a school system, that really doesn't really fit the bill in terms of all the things we've talked about. It would be humanly impossible. But I thought that there were some really interesting statistics that Kathy shared with me, that there are really economic ramifications to not having a school nurse. So if you're looking at school budgets and looking for places to cut, you may say, oh, do we really need a school nurse? We can cut that out. Or we can have the school nurse covering 3, 4, 5 schools instead of having 4 or 5 school nurses, one for each school. But there was a very interesting study just done a couple of years ago in 2014 in Massachusetts, and they were able to document that if you don't have a school nurse, you're really going to have other kinds of costs. So the medical procedures that a school nurse can do, these would be medical procedures such as what Kathy was talking about, like ventilator care support, or any kind of hands-on nursing procedure that can simply not be delegated to someone else. I was going to ask you, by the way, epinephrine, can that be given by anybody other than a school nurse?
It can be given. The undesignated epinephrine that our law surrounds, it has to be given by a nurse or someone who's been trained to give the epinephrine. But the Good Samaritan law does support a student who has their own epinephrine provided for them by their doctor, does support that if in an emergency it should be given. The problem is that people don't do the proper assessment. Epinephrine has to be given at the first signs of this anaphylactic reaction, of the throat closing. And what happens is people wait too long.
Right.
And so while they certainly can give it, and I would encourage anybody who has a question, if you're wondering if you should give it, would be my advice. But having the nurse there, there's evidence to show that they certainly are going to give it sooner, and it'll be more effective.
More effective, right. And that's not any small thing, because if you're not used to doing this, you're not a nurse, and you're like standing around like, should I give it? Shouldn't I give it? Am I the right person, or should it be somebody else, or who should we call? That's really tough. So we can save $20 million in medical procedures. Teacher productivity, so that the teacher isn't distracted, saves $129 million, and parent productivity, meaning you, not having to rush off because there is someone that can take care of your child until you can get there. That's another $28 million. So I think that there are economic consequences, as well as quality of a child's life, quality of the teacher's life, and quality of you, the parent's life, that are really factors that need to be taken into consideration. And as we wind up, I'd like Kathy to just let you know that she does teach a really robust program on an advanced way for school nurses who are already in the field to be learning even more. Right. So this program is fantastic. What's the name of the program?
So the School Nurse Certificate Program here at the U.I.C. College of Nursing is what we'd like you to come consider for any nurse who's out there thinking they might be enjoy school nursing or be interested in school nursing. We certainly would invite you to consider it. And for anyone out there who thinks someday they want to be a school nurse, go ahead and get your RN and then give me a call, because I really think that this is a great way to have a nursing career and to support students and families so that they are healthy and ready to learn.
Right. This School Nurse Certificate Program is really well regarded throughout the state of Illinois. Many students have come to this, and they really give rave reviews. You can see why, because Kathy is running the program, and she has other faculty who are equally enthusiastic about what they're doing. So they inspire the school nurses to do even better. So as they're learning new techniques, or they're learning more about evidence-based practice based on research and literature, they're also getting to know one another, and they really are enjoying learning about how each other are doing their various care, and they are bonding and really getting their own network organized. So I think that's very good. So I hope that one of the things that you would take away from this is the importance of school nursing. And if you have any questions for Kathy, she can be accessed through the U.I.C. College of Nursing website. You can find her bio and her contact information there if you want to get in touch with her directly. I want to thank you all for listening today. I hope that this was helpful. And remember, with health, all things are possible. Have a wonderful afternoon.